Assalamu alaikum students. This is the second part of local control of blood flow by tissues, and this is the continuation of this topic, this lecture. Oxygen lack theory for local blood flow control or nutrient lack theory. As you have studied in the first lecture about vasodilator theory, and the second is oxygen lack theory. So in vasodilator theory, the vasodilator substances play their role while for vasodilation, and in oxygen lack theory or nutrient lack theory, in this theory the lack of oxygen, the ischemia, plays its role in the vasodilation. So these two theories result in vasodilation. While special examples of acute metabolic control of local blood flow, there are two main examples of acute metabolic control of local blood flow, that is reactive hyperemia and active hyperemia. As a reaction to, firstly, reactive hyperemia, very important, as a reaction to blockage of blood supply, when the blood supply to a tissue is blocked for some time and then unblocked, blood flow to that area will increase. So when normally blood is flowing towards the tissue, but when we blocked that supply and then release that block, the blood flow to that area will increase, because when we block the blood flow at first time, there is more pressure of blood on the side of that blockage. So when we unblock the blockage, the pressure is released. So when the pressure is released, which was built during the blockage time, because of the accumulation of blood due to blockage, and this pressure is released due to unblockage, and that's why the blood flow to that area will increase. And the other reason is that when the blood flow is blocked to that area, the area becomes ischemic. So when the blockage is unblocked, when the blockage is removed due to ischemia, the blood rushes towards the ischemic part of the tissue. So there are two reasons for reactive hyperemia. One is due to the blockage, pressure builds in the blood which before the blockage, and the other reason is the ischemia. Ischemia occurs in that tissue where blood cannot reach due to the blockage. So the other concept is active hyperemia. Whenever tissue becomes active, for example exercising muscles, active hyperemia, hypoxemia, increased metabolism, increased blood flow. So when their muscle is active, there is a decrease in oxygen in the blood, and there is increased metabolism, so there is increased blood flow. For example, brain during mental activity or exercising muscles need more blood flow because there occur more metabolism, and there is more need of oxygen there, more need of nutrients there. So active hyperemia means when the tissue is in active state, there is more metabolism, there is more blood flow. Autoregulation of blood flow when BP changes. This is also very important concept. If in any tissue of a body, acute increase in BP causes blood flow to increase, but blood flow returns back to normal. This phenomena is autoregulation. Why this autoregulation occurs, we will discuss in this slide. Between blood pressure 70 to 175 millimeter of mercury, blood flow remains autoregulated. Two mechanisms for autoregulation are metabolic theory and myogenic theory. These two are very important, which autoregulate the local blood flow. One is metabolic theory. Increase in blood pressure provides more oxygen and nutrients to the tissue. Excess oxygen causes blood vessels to constrict, and the flow returns back to normal despite increased pressure. So when the pressure increases, there is more supply of oxygen and nutrients to the tissues, and as I have told you that when there is more oxygen, it causes vasoconstriction, and this vasoconstriction causes the flow returns back to normal despite increased pressure. So this is the metabolic theory. Oxygen, the level of oxygen regulates the blood flow towards the tissue. This is the summary. The level of oxygen regulates the blood flow towards the tissue. If the oxygen is more in the tissue, then there is vasoconstriction and decrease in blood flow to the tissue. Decrease means the blood flow returns back to normal despite increased pressure. And myogenic theory suggests when BP increase stretch of vessel wall, which constrict, and blood flow is minimized to normal. When BP decrease, smooth vessel of a vessel relax to allow rapid blood flow. Okay, so when the BP increase, there is stretching in the vessel walls, and the blood flow is minimized because there is vasodilation, and the reverse will occur in case of decrease in BP. Okay. Myogenic. So it correlates with the smooth muscles of vessel wall. So when the BP is increased stretch of vessel wall, smooth muscles which constrict, and blood flow is minimized. There is a special mechanisms for acute blood flow control in specific tissues. For example, tubuloglomerular feedback mechanism, juxtaglomerular apparatus. Composition in concentration of fluid in distal convoluted tubules is detected, and appropriate signals sent to efferent and afferent arterioles to control blood flow. So the blood flow towards the kidneys is controlled by the concentration of fluid in distal convoluted tubule. And in brain, in addition to control of blood flow by tissue O2, concentration carbon dioxide plus H plus ions concentration play important role for blood flow. You will study also in respiration chapter about this concept, how oxygen, carbon dioxide and H plus ion control the higher centers for blood flow. When carbon dioxide or H plus ions are increased, blood flow is increased. But when oxygen is increased, there occurs vasoconstriction due to increase in oxygen. So blood flow is decreased. And when microcirculation or microvascular blood flow is increased, endothelium-derived relaxing factor, which is nitric oxide, is released, which causes dilation of large blood vessels in the upstream direction. Okay, so the nitric oxide is the vasodilator for microcirculation. So when there is a vasodilation, there is increased blood flow. Okay, long-term blood flow regulation, new blood vessel formation to meet increased body requirement. Oxygen plays an important role in both long-term plus acute control. And the importance of vascular endothelial growth factor, VEGF, in the formation of new blood vessels. There are important angiogenic factors, VEGF, vascular endothelial growth factor, FGF, fibroblast growth factor, angiogenin. These are the substances, angiogenic factors, which causes angiogenesis for long-term blood flow, which takes days, weeks, or months. It is the deficiency of oxygen, nutrients, or both, which cause the formation of angiogenic factors. So the main stimulus is deficiency of oxygen and nutrients for these angiogenic factors. Development of collateral circulation, phenomena of long-term local blood flow regulation. So the collateral circulation develops. Collateral circulation means there is a normal circulation towards the tissue, and if more blood flow required to that tissue, then the collateral circulation will develop. That is, the new vessels are formed adjacent to the mainstream vessels. Okay, so this is our topic of local blood flow, local control of blood flow to the tissues, which consists of two parts, acute and long-term control. In acute control, you have seen the concepts of vasodilator theory, oxygen lag theory, active hyperemia, reactive hyperemia, and then metabolic theory, myogenic theory. And in long term, you have seen the process of neoangiogenesis, new vessel formation, and the angiogenic factors. And the stimulus for these angiogenic factors is oxygen and nutrients. And there is a formation of collateral circulation, that are the formation of vessels adjacent to the mainstream circulation, the mainstream vessels of that tissue. Okay.